Welcome to another episode of Health Matters with PA Lynn Szabo. What are we going to talk about today, Lynn?
AEGIS.
AEGIS.
They're new in town.
AEGIS are new in town?
Yeah, AEGIS.
Oh, not okay. So I'm thinking of the wrong word. Okay, what is AEGIS?
So it's the name of a new business in town across the street from Big Five, across the highway there. A new business has opened up, and it's not new to the area. There's an AEGIS located in Eureka that a lot of Del Norteans use, but they've expanded up north, and I think that's a good thing. It is a drug treatment center, and a lot of people who, clients and patients who needed this kind of care, especially daily care, have been bused from Crescent City to Eureka, and I think now they decided that it was worthwhile to come up here. And the information I got from them is from their website, and I really don't think it represents the services available in the smaller outreach clinic here. I think they're trying to start with a soft open.
Gotcha. So what kind of services do they operate, or were they saying on their website that you don't think will be available here?
So they're going to, I think they could expand, but they're focusing right now mostly on medical assistant therapy for opioid and narcotic addiction. Okay. And I think they're going to go from there.
So like Suboxone Clinic? Don't we already have one?
Yeah, which is kind of interesting. We have one at all the clinics, except I don't think Sutter has one. They might. Any provider, licensed provider in California can take a class in it and then prescribe it. But it takes, there's a lot of providers who are not really interested in doing it because it's perceived as a difficult patient population to work with.
Gotcha.
Yeah.
So if we already have the Suboxone clinics here with our providers, why do we need AEGIS?
I don't know. That's why I wish they would have communicated with me for. But what I do know is if you have a need or an interest, you're going to have to call them and get the most up-to-date information.
Gotcha.
So and if you've been commuting daily to Eureka to get treatment down there, I imagine this is a welcome addition.
I bet so.
Yeah. So on their website, they say they accept Medi-Cal, Medicare, TRICARE, which is for the military, and most commercial insurances, as well as have a self-pay option.
Okay.
So that's kind of...
So they're open to everybody.
Yeah.
That's good.
And inclusive. And they have an opioid treatment program, like I said, with medical-assisted treatment, including Suboxone and methadone.
Oh, so is that... We don't have a methadone clinic here, do we?
That's the difference, yeah.
Okay, so that makes sense now.
Right. And that's why people, I think, were going down to Eureka every day to get their daily dose of methadone.
Okay.
Okay. And to be eligible for treatment, you have to be 18 years old. You have to be a competent, independent individual, and this killed me, who is not enrolled in another treatment program. Or getting MAT, which is medication-assisted treatment from another source.
So no double dipping on your methadone treatments?
That double dip, I find it...
Isn't that just doing drugs?
I found it kind of funny that they specifically said that.
That is kind of
Maybe
funny.
It's an issue.
It could be.
And then you have to pass an evaluation by their medical director, which includes reviewing prescription refills on Cures. And Cures, for people that don't know, is a database in California now extending to Oregon, where if I go on it and type in a name, a birth date, I can see what kind of controlled medications an individual got over the last year.
Okay, so like if I, just as an example, if I was somebody who was addicted to opioids and I went through the Suboxone treatment thing and I had agreed to be on the Cures when I went.
You don't have to agree to be on the Cures. You're on the Cures.
You're on the Cures. So when it's checked on it, they can see that if I've gone back to taking opioids again.
Yeah, I can see, oh, look, this person in the last 2 weeks has gone to 8 doctors with pain complaints.
Gotcha.
And gotten opioids.
Okay.
So it used to be a big problem, actually, in this town where people would get opioids and then go to acute care, like the old Sutter acute care across the street from the hospital, and then claim their doctor never called in the prescription, or they have a new pain complaint without disclosing that they just got, 25 Percocets the day before. So now we know stuff like that.
Oh, okay.
And it's not as easy as just changing pharmacies.
Will that make it easier I'm sorry to get off topic here a little bit, but will that make it easier to stop the addiction rate because we went because we had pain and we accidentally became addicted to opioids,
Right.
and then we're going to seek them out with different providers.
Right.
Will this system stop that so that the doctor can be like, hey, this is the sixth time you've gone in a month to try to find this medication. Maybe we need to get you some treatment so
Right.
that it doesn't become a
Right.
problem.
You remember when Gerald Huffman came to the area, and there was somebody who had a concern about doctors over prescribing opioids in this community? We're all legally required to look patients up in cures.
Okay.
I know we used to have a little bit of out because some people would go into Oregon and get opioids, but now we can look in Oregon, and we're required every time we prescribe it to spend a couple minutes on the Cures website, which is a time burner, but the information is probably worth it. And then nobody can prescribe when they see that somebody was up at the Curry Acute Care Center and got,
Okay.
30 bikes
So
the day before.
it's a pain in the butt right now, but long term, this will have an impact on.
Well, it's been going on
opioid
for
addiction.
a couple of years.
Okay.
So, yeah, this has definitely cut down how we prescribe.
Well, okay, that's a
The
good
amount
thing.
that I prescribe has definitely been affected by the Cures program. The other cool thing about AEGIS is they will take pregnant women up to the third trimester.
Okay.
So if a woman is using, she finds out she's pregnant, she decides to continue the pregnancy but is having a hard time not using street drugs, then she can go and get medication-assisted treatment there
Okay.
up to the third trimester.
And this is substantially safer than using the street drugs I'm taking.
Totally. But I
Okay.
think the OB, I know UHS has medication-assisted treatment, and it's possible that Dr. Kirk's office does too, but I don't want to speak for him.
Okay.
It's probably something that's not really talked about much. But I like that. I like that they offer hope for 2 generations there.
Right. It's unfortunate to me that we don't get to talk about these things because of the stigma that's attached.
Oh, totally.
And then people don't know where to find those resources to stop it from becoming a problem where they're looking for street drugs to take care of a medication addiction.
Yeah. It also keeps people unaware of what a problem it is in the community, and we'll talk about that in a minute. So what I liked about them on their website is they have a patient rights handbook. I don't see that very often, and I like that.
Yeah, that is cool.
This is a difficult situation that you're seeing somebody at their worst, really, and they're asking for help. So that, the interaction between the provider and the patient is protected on both sides, to me, I think is amazing.
That is a good idea.
Helps even out the power differential. They also have a patient advisory and advocacy group. So they've got people that have gone through the program or probably are going through the program that can advocate from the addicted person's point of view.
Kind of like peer support.
Yeah. But they have a voice in this, and I think they reference some policies that were the result of the feedback they got. So they're listening. So not only exists and it speaks, but people listen to it.
That's
which I
good.
thought was good. They do use a form of 12-step program, so I don't think they use an actual, AANA kind of program, but they're inspired by it. And I don't really know what the difference is, except a lot of people find the religious part not something they can work with, so it's possible that they have a step around that.
Just off topic a little bit, I don't know if you know the answer to this or not, but is the AA 12-step, is that data driven? Is that data supported? Because I hear all the time that it's not data supported.
I can only address that anecdotally, and that's kind of interesting. I'll get back to you on that one. But for me, if I walk into a room and I ask somebody what step they're on and they can't tell me, then it means they're in trouble.
Okay.
Yeah. So anecdotally,
I just meant as overall for addiction is a 12-step program, a data-driven, supported that this is effective. I know several people that have used the 12-step program and they say that it was effective for them, but then I hear other people that say there's no data to support this. That's just those people got sober.
I don't know that's true.
With that system. I don't know if it's true either. That's why I was asking.
I think actually 12 steps are rules for living right. And part of living right is living with sobriety for most people who have had a problem with not being sober.
Yes.
So
I would agree with that.
Yeah.
But I don't know if it's a data-free zone, as you say, or not. So that's why I thought I'd ask.
I don't know. I'll look. I mean, I would imagine somebody has asked that question. These people at AEGIS also have special expertise with early recovery, which I think is good.
What's early recovery?
So that's trying to nip a problem in the bud.
Okay.
Okay, so people don't have to go for years without help.
Gotcha.
Which I think is super important. And they also have financial aid support for eligible clients. So that's what I like about them.
Nice.
But like I said, I don't think that their website accurately reflects what's going on in town right now at that little place across the street from Big Five. So it makes sense to call them. Their phone number is accessible online. Some other interesting options is they say they have a 21-day detox taper program, which I don't really think is happening here. I think it happened for a while in Eureka.
Like an in-house sober?
Yeah,
okay.
In-house. And then somehow it wasn't available anymore. But they do advertise it on their website. So I'd like to know more about this. If anybody knows anything, get back to me. I'd be curious. Their scope of services include case management, counseling, both individual and group counseling, crisis intervention, and risk management with case conferencing. So what that all means is social workers that kind of help with problems that addicts might have. Like they might have transportation issues. For example, if they live up here and they're getting methadone daily in Eureka,
okay,
then part of keeping them on their program is to get them down there daily. And so there was a little bus that left.
Why is it because you can prescribe Suboxone for somebody to take daily on their own, right? They don't have to show up to a clinic and take it?
Yeah. Methadone is different than the Suboxone.
Okay. In what way?
Methadone is probably not something. I've seen a lot of people accidentally kill themselves with methadone.
Oh,
Methadone
that's not good.
has it's an opioid. It has a really long half-life. And if somebody's using like a certain amount of heroin on the street, then the dosing equivalent of methadone is going to feel to them like they're underdosed.
Okay, so
because it takes a while to build up in the bloodstream. And so they take extra because that's kind of a common addict thing is...
Yeah. Okay, so it's just not safe to do that for them to do at home. Yeah, okay, that makes sense.
Oftentimes think their body tolerates drugs differently and they need more.
Okay, kind of like an alcoholic.
It's part of their addiction.
Drink more and more to get the same effects? Okay.
Right. And with methadone, people can all of a sudden have an overdose situation and die.
Okay.
I've seen that.
Okay, thank you for clearing that up for me. I did not know.
And Suboxone is not... I don't know if it's an opioid antagonist. So what it does is it plugs the mu receptors in the brain. So all those little receptors that are hoping to get high, it plugs them so that
they can't.
They can't. Okay. Yeah.
But so it's kind of like the same medication that an alcoholic would take, so that when they drink alcohol, it kind of makes them feel sick and yucky.
No, that's a different one. That's an antagonist. You're talking about antabuse. It's slightly different, but every day that you take a medicine like this, you're committing to a sober
That's
day,
true.
or no drug use day. Otherwise, there's going to be consequence. So it's similar like that.
Okay. Clearly, I don't have a very big background on what addiction stuff are.
Pharmacokinetics.
No, don't have that either.
So one thing that happens with addicted people is there's like a crisis a minute. So, they've been neglecting sane functioning of their lives, and they've got things in their life that are not working out. So that are different, like they haven't done their paperwork to keep up their Medi-Cal, or their mom threw them out on the street again, and so these people also have ways to kind of help with those kind of crises.
Okay.
Also, a lot of drug use is an attempt for a person to manage mental illness. And so when you get them off the drugs, and the mental illness comes roaring back. And so then you have to work on getting them into mental health.
And you're talking about the mental illnesses that so many in our community have, like depression and bipolar and those types of things. You're not talking about I hear voices and
sometimes
see things and like schizophrenia. You're talking about like the everyday, I have anxiety and this is how I coped with it. And this is okay.
Right. So all of the above. They state on their website that they are trilingual. So they have services in Hmong, Spanish, and English.
Oh, wow.
So I thought that was cool.
That is cool.
And then they offer aftercare to help with a sober life. So people's problems once they get sober don't just disappear. So you've got a person that's a little bit fragile, kind of psychologically fragile, that all of a sudden has all this stuff thrown at them. That's their stuff, legitimately, but they turn to drugs because they didn't handle it well in the beginning, and now they don't have that crutch anymore.
Yeah.
And it really is difficult for them.
I can't imagine. And then you have to rebuild all of those relationships that you valued before your addiction that you still want to have that you've kind of ruined because of that.
Right.
And then
if you're working your 12 steps, part of that is admitting that you were the problem.
Yeah.
And that you have to go to people that maybe you had conflicts with and have a fearless moral inventory, a conversation with them where you apologize and you own your stuff. And that's super hard.
It is. It is incredibly hard. I know when I used to be in a position to hire people, and my favorite people to hire were the ones that were recovering drug addicts. The work ethic and the integrity and the level of honesty that was from those people was phenomenal. Mm-hmm. The trust that I could place in them was extraordinary, and it was worth the little hiccups as their brain healed if they forgot something or they left the lights on or whatever it was that was a little thing. Right. It's just phenomenal. People in recovery who are changing their lives are amazing human beings to work with and be around.
Right. And definitely a resource this community should have.
Absolutely. I just, again, the stigma. If you remove the stigma and actually look and experience what that is, it's amazing.
So the drugs they work with are people who have problems with, or the drugs they work with are not people, but the drugs are alcohol, opioids, cocaine, Adderall, benzos, other prescription drugs. That's probably opioids, I'm thinking, fentanyl and meth. I don't know of any way to medically support somebody through meth addiction. So some of this is going to be interesting. And like I said, I would call them and see if this site is doing all that.
Okay.
Before I got too excited.
Yeah.
But going back to your last comment, and what I didn't like that I've seen on the internet is there's a Facebook vibe about how a drug treatment facility in this town will draw people with addiction problems to this area.
Do they not?
Yeah, newsflash.
Do they live in their homes and never come out?
They're already here.
They're everywhere.
Yeah, I mean, Delnor has a problem. This is a local solution. It's not going to be a complete solution. It's not going to be everybody's solution. But this is way better than what we had before this opened.
Absolutely. And you said they talk about alcohol and a myriad of different drugs. We're not just talking about people who were doing meth. It's
right.
Yeah. I mean, we have a prominent person in the month of November that is waiting to see if the judge accepts their plea bargain or not for a DUI felony hit and run. So, I mean, it happens. It happens all over our community to everybody out of every class and every station of people.
It sounds like this offers us more hope than we've had in a long time.
Yeah.
There are a lot of medical treatments, especially for helping people with alcohol. So if somebody out there has a problem, this is hope. This isn't stigma. This is hope.
Thank you.
And I I don't, the presentation of the AEGIS had a really hard time getting information. I almost didn't want to, talk about it on the radio because I feel kind of wobbly about the information I'm bringing to you guys. But this is too important, and there's a little bit of a backlash to their being here. There's some speculation that the clinic will cause the tourist industry harm, which I think is nuts. They are very under the radar. It took me a while of driving back and forth to kind of figure out that they were really there.
But even if you drive by and you see something that says AEGIS or Halfway House or whatever else that just says in our community that we're loving on our neighbors and we're taking care of our problems, and it doesn't, I don't, that's just so silly to me, that this whole not in my backyard thing, but fix the problem makes no sense to me.
Right. And well, the only way it can is if you deny the problem exists, and newsflash out there, it exists.
Right. Again, it's touched. I don't know a single person that has not been touched, whether within their own family or with a close family friend with addiction.
Yeah.
Every family.
I wish that they would add marijuana into this, because marijuana is kind of a big problem up here. People get really sick from that cyclic vomiting syndrome, and it burns up a lot of ER resources. So that I would hope they would add that in. But I wish even more that the community would recognize that what a welcome addition that this really is. And I'm hoping we hear from them more. I'm hoping this opens the conversation. Maybe Redwood Voice can reach out and Jessica can do an article about them, because we need information. We need to inform some people of what a good thing this is for our community. It's
a phenomenal thing, and to embrace them within the community for helping, again, our families, our friends, and our neighbors, because that's what they're offering.
Right. It's totally welcome, in my opinion. And I think it's gonna do good things. And they seem to be inclusive. So if somebody goes, well, I just have medical, there's no hope for me. Not true. So
yeah,
I would give them a call and kind of define some of the finer points of this, because I think I was looking at a very generalized, maybe big city version of what they are. And I don't even think the website represents what they are in Eureka. I think for the smaller cities, they either have fewer options for treatment and kinds of treatment. And then I think this one appears an outreach one right now, and they're trying to gauge what they can best help the community with. So it would be to people's best interest to call and just get information directly. I found them pretty open to answering questions.
Okay.
Yeah.
Well, that's good.
Yeah.
So what would be your suggestions on helping remove, and I view it as hypocrisy when we say we want, in our community, we need to do things for mental health, right? We don't want to have gun control because it's mental health problems. It's not the gun's fault, it's mental health. And then we don't want to fund mental health trainings. And then if we bring in something for drug addictions, we like, oh, not in my backyard, you're going to affect tourism, it's going to look bad on us. What do we do to combat the hypocrisy of those things?
Maybe adopt the 12 steps, because a fearless moral inventory would be a good way to actually realize what somebody who believes that is actually saying, and what kind of catch-22 they're putting people in, because that becomes impossible and the problem will never be solved. That's just, I think, a kind of a roundabout way of saying, I like my guns, I want to keep my guns, and I don't want anybody to get in my way with getting them.
Yeah,
but it could be other things too.
Right, like we talk about it, right? We talk about the homeless problem, and we want to combat homelessness here. Well, a lot of the homeless problem is because of addiction, and like what you were saying earlier, is
and mental illness.
Mental illness. You covered up your mental illness. You dealt with it by doing drugs, and then your mom kicked you out the house, and now you've got nowhere to go. And who's going to hire you, right? If you're not clean and you're addicted to drugs and living on the street. It's just a cycle, and I don't know how people want to break that cycle if we don't have mental health services. And we talk about it all the time, like, oh, we have this, and we have the PATH program and emergency responders now for mental health, and we have our county mental health department. But if you're not on Medicaid, you're not seen at the county mental health. Right,
and how do you get it together on Medicaid if you're manic and standing on a street corner yelling at hallucinating.
Right.
I mean, and you don't have a ride to get to the place to do the paperwork, or you have to use a phone to stay on hold for 3 hours to get somebody to help you, or you don't read in English because you speak Spanish as your main language. I mean, there's a million. We've seen it all, Heather.
We have seen it. And it's, to me, again, right, it's the stigma. And now we've made it even more difficult with the barriers to care. You have to sign back up every 6 months,
Right.
or you lose your benefit. And if you've lost it for so long, I mean, just the barriers that we're putting in here, that when we talk about trying to address these problems that we have, that are just going to make them worse long term, that's just going to make it worse.
Right.
I don't understand. And again, it goes right back to the, like, well, not in my backyard. And I'm glad AEGIS is going to take private insurance to help those people that are slightly above the amount to get on Medicaid and those types of things. I think that's really important.
Yeah, there's a lot of people actually who are functional addicts. When I took care of people with HIV and their drug regimes were so complicated, we were always kind of quietly relieved if somebody was also a heroin addict, because heroin addicts are really good about getting their meds at the right time. They're really good because they can really feel miserable if
they miss their meds,
running late on something. And so and that's a skill they have, and they extend it to their other medication. People on meth are like chaotic and not able to function like that. So anyway, that's beside the point. I just hope that these people reach out and talk to the media, because we are interested in what's going on there and how we can, as a community, make it work for them so that they can make it work for us.
Yeah. In our community up here, we like to not we as you and I as individuals, we as a community as a whole like to tout our Christian conservative values. And I just like to point out to people that Jesus said to love.
Yeah.
Jesus said to love and to embrace these people and
right.
to do unto them as you'd have them do unto you. And I don't understand, again, why the backlash people are having in the community about not in my backyard.
They were talking about how it was located at the border of the town, so it would be the first thing tourists would see. It's well known.
So?
Yeah, so what? A solution is the first thing the tourists would see. Most of the time they're coming from big cities. They're not naive.
Yeah.
So.
Well, that too, like, who knows that AEGIS that's what it is? If you know what it is, then you're grateful they're there.
Right.
I don't know anybody from Wisconsin that's going to drive through and be like, oh my God, look, it says AEGIS. They're giving away methadone to people who are trying to get off drugs and have a fit about it.
It has a tiny sign. A tiny sign.
I don't care if it was a neon sign, Lynn, and it was flashing. Who cares? Seriously.
You could go right by it and never notice it. So I think people who want to come and see the trees are going to come and see the trees.
Exactly. Again, right. It's the hypocrisy and the not in my backyard and anything. We're going to fix the problem, but not like this. It has to stop. It's just got to stop.
Yeah.
All right. Well, thanks, Lynn. That was fun.
Yeah. Interesting.
Yeah. So don't do meth. Don't get addicted to opioids.
Yeah.
All right. Anything else that we should not do?
Work your steps. The rules for living, right?
Work your steps. The rules for living.
Yeah.
Thanks, Lynn. I appreciate that. This was another episode of Health Matters with PA Lynn Szabo. If you'd like to listen to this episode again or any of the episodes that Lynn has done over the past 7 years, you can go to KFUG Radio YouTube channel and select the playlist and find any of those episodes there. Thanks, Lynn. I'll see you next week.
Thanks.